the case for a protein intake that is greater than 0.8 grams of protein per kilogram of body weight is a no-brainer now. But what are the actual recommendations for daily protein consumption from different organizations? Unfortunately, the answer varies across organizations. The American College of Sports Medicine recommends 10 to 35% of your total calorie intake to come from protein, which equates to about 200 to 700 calories in a standard 2,000 calorie diet. They also recommend increasing protein intake to 1.0 grams per kilogram of body weight after around age 50, and increasing even further in active older individuals. This is not bad considering all of the research supporting more protein for improved body composition, health, and performance. But if you are very active, then what? How much do you need then? Well, the International Society of Sports Nutrition recommends 1.4 to 2.0 grams of protein per kilogram of body weight for active individuals to improve training adaptations to exercise. This is strongly endorsed by the most current research. Other leading international organizations like the Academy of Nutrition and Dietetics and the European Society for Clinical Nutrition and Metabolism recommend somewhere between 1.0 and 1.7 grams of protein per kilogram of body weight, depending on your activity level and health status. So, recommendations are beginning to increase, and the research tells the story. And just to recap, some food sources that are great for protein are eggs, lean chicken, beef, and fish, and things like Greek yogurt, nuts, peas, tofu, seeds, and quinoa also pack a protein punch. And even though I mentioned this in the beginning of the lecture, it is worth repeating, because one of the questions that I continue to get asked regarding the amount of protein we eat is this: is too much protein harmful, and won't my kidneys shut down? I want to tell you again, absolutely not. This is wrong. But the myth persists. We already talked about the research support for a higher protein diet. These studies show no evidence of kidney disease resulting from eating more protein. Here's the deal. On a high protein diet, your kidneys do perform more work to handle the protein. However, increased action does not equal damage. This is because, like all our other bodily functions, the kidneys are very good at adapting. And one study found that markers of kidney function are not affected in strength athletes with multiple years of high protein intake. However, there is likely a time when you don't need any more protein. More than 1.5 grams per pound or 3.3 grams per kilogram of body weight is not needed or recommended, as 1 gram per pound, which is 2.2 grams per kilogram of body weight, is enough and far exceeds the 0.36 grams per pound or 0.8 grams per kilogram that is traditionally recommended. Overall, there is no overwhelming evidence that says that protein harms the body, but anything in excess can potentially be damaging. That's just common sense. But unfortunately, common sense sometimes goes out the window when people talk about new diets and eating fads. And of course, always double check and change your diet with your healthcare provider to make sure it's a healthy choice for you. Now, let's go beyond just how much protein we should eat and move on to topics like when we need to eat it and at what frequency we should eat protein. This is a concept called nutrient timing. The first thing to talk about is, when do you want to eat? For example, if you like breakfast or a late night snack, then eating at those times will probably help you stick to your plan. However, the food you pick and eat at those times will make the difference in how your body ultimately stores the energy. So, how should your daily protein needs be split up over a day for the best results? Well, eating about 20 grams of protein per meal, spaced evenly throughout the day, is commonly recommended. The research here is mixed though. Unfortunately, research shows us that older individuals typically consume about 8 grams of protein at breakfast, 12 grams of protein at lunch, and a maximum of 40 grams of protein at dinner. And this type of spread of protein is considered protein backloading. It is very common, but for optimal results, it seems that the dose of protein should be spaced a bit more evenly throughout the day in order to stimulate muscle protein synthesis. In overweight and obese older individuals, evenly spaced protein stimulates muscle protein synthesis significantly more effectively than this backloaded practice. Interestingly, when resistance training is added, muscle protein synthesis normalized no matter how they ate their protein. Backloaded or not, resistance training improves how we respond to eating. A study that I worked on showed that a higher protein diet, 35% of total calorie intake, spaced across 6 meals per day, significantly reduced body fat and abdominal fat, and lean mass remained higher compared to the same amount of protein eaten over just 3 meals per day. And when compared to a more common and lower protein intake like 15%, the high protein eaten more frequently approach was also better for body composition and metabolism. Think about it like this. If you can spike your protein synthesis on more than one occasion in a day, you will probably have a better net effect at the end of the day than only spiking your muscle protein synthesis at one meal, where you happen to get all of your daily protein. But I also know people who simply don't like eating frequently. It can be a hassle and take too much time. Well, you can also have great results eating less frequently. You just need to be sure that when you do eat, you're eating nutrient-dense foods and that you're getting high-quality protein in those foods. Now, another time of day that people often want to eat is before bed. Do you find yourself hungry before bed, maybe wanting a snack, but believe that it's not a healthy habit? It's not only not unhealthy, it may actually be good for you to eat a small protein snack or drink a protein shake right before bed. When younger and older men were given 40 grams of casein protein before bed, their muscle protein synthesis was significantly higher overnight when they drank than when they drank a no-calorie drink. And this was regardless of their age. And it worked for young and old alike. Now, this was not done in women, but I think similar results would occur. This study shows us a couple of things. One, you may be able to improve your body composition by having a nighttime protein snack. And two, although older men have lower rates of muscle protein synthesis than young men, both age groups have an increase in muscle protein synthesis when taking a protein shake before bed. But how do other macronutrients and other forms of protein eaten before bed, besides casein, affect metabolism and health? Interestingly, a study from our lab showed in young active men whether eating a carbohydrate, whey, or casein protein snack before bed that had about 140 to 150 calories in total, resting energy expenditure the next day was increased compared to eating nothing at night before bed. But when we did a very similar study in obese women, their next morning resting metabolic rate had a more favorable increase if protein was consumed before sleep, but interestingly, not with carbohydrates. The difference was very small, but the pattern that we noticed was pretty interesting. Essentially, the effect of a nighttime snack on next day resting metabolic rate was influenced by the sex, age, and fitness level of the person in the study. What about the effect of nighttime eating on body composition? Well, we looked at this over a 4-week period where overweight and obese young women had a carbohydrate, whey, or casein snack before bed every night. And they also exercised 3 days per week. Now, though nobody lost weight, all 3 groups increased their muscle mass in the study. What's more is that the whey and casein groups, they had protein, tended to decrease fat mass, whereas the carbohydrate group had no change. Now, these differences were very small and not statistically significant, but it has pushed us to look further into new research to see exactly what is going on. The first study to look at 12 weeks of nighttime eating before sleep and exercise training recently found that by simply drinking a protein shake before sleep, muscle size was improved and so was strength. Now, it looks like a very small 150 calorie protein drink before bed may actually be advisable rather than something to avoid. But I'll be the first to tell you that much more research is needed in this area, and I'll talk much more about nighttime eating later in this course. In sum, protein consumption should be on the top of your mind and probably timed to multiple feedings in the day to achieve your optimal body composition results. But it can also be difficult to eat a lot of protein meals. It just makes sense that you may feel full. So, an easy way to add extra protein is in the form of protein powders. There are many types of protein powders on the market. So let's just talk about a few things to look for before you purchase one. First, there are many forms of protein. Whey protein isolate is considered the most pure form of protein. Hydrolyzed whey protein isolate is the most expensive because of the purity and the process involved to make it. But whey protein concentrate has less filtering and therefore more natural carbohydrates and fats from milk, making the protein content lower in most cases, about 35 to 80% protein depending on what you buy. The other two very common sources and types of protein powders are from casein, which is also from milk, and soy protein. Although these proteins also increase muscle protein synthesis, whey is usually considered best for improving muscle protein synthesis, especially post-workout. This is because of whey's higher leucine content, the essential branched-chain amino acid that contributes the most to muscle protein synthesis. Casein and soy are good options, though, for people who just don't like whey, want something that is slower digesting, that would be casein, or for vegetarians who might choose soy. But many other sources also exist, like hemp, pea, and even bug proteins. But less research exists on those. Milk, as you probably guessed, is also an acceptable source of protein and been found to increase lean body mass greater than soy protein after 12 weeks of a resistance training program. But keep in mind that milk also has both carbohydrates and fat in it. So, what do you look for on the label of a supplement? Well, you want the highest percent of protein per scoop. You ideally want a powder with more than 80% protein in each scoop. For example, 25 grams of protein in a 28-gram serving scoop equates to 90% protein.